Hello there, and welcome to another edition of Health Matters, a presentation by the Ministry of Health. And this program seeks to bring you information on various health issues affecting the people of Guyana. With me in the studio, I've got Dr. Anastasia Samson and Dr. Reza Niles. They're both from the Neglected Disease Infectious Department of the Vector Control Service of the Ministry of Health. Doctors, welcome to our program. Coming up on December 30th, we've got the WHO has got this Advocacy Day of Neglected Tropical Diseases Day 2022, achieving health equity to end the neglect of neglected tropical diseases and other poverty-related infections known in the region of the Americas as neglected infectious diseases. Well, this has been recently, this is the second time the world will be observing this day, but the Ministry of Health, they've got this department for a good while now, and we'll be finding out more about it. So I'll start with Dr. Niles. Dr. Niles, tell us about your department.
First of all, thank you for having us, Mr. Hussain. The Neglected Infectious Disease Department is a sub-program within the Vector Control Services. And the Vector Control Services has been around for a long time, but our department is a bit young. Nevertheless, we are perhaps well known for the filaria campaign when people come house to house to distribute the chemical prophylaxis or the drugs that you take to help prevent lymphatic filariasis. And we also look at about 4 other neglected infectious diseases within our program. Our program is really centered in Region 4, but our aim, especially this year and the following years, is to really decentralize this program. We look at, apart from the, as we know it as filaria, we also look at soil-transmitted helminths, or what we call worms in Guyana. We also look at shaggers, and we look at leishmaniasis, which people know as bush yaws or life sore. So our program is a program of many diverse infections, but the reality that neglect, that first name is important because it's really associated with diseases that we see that are characterized in, tropical areas, people of a certain standard of living that is below the standard that we would recommend. They often have issues with water safety, perhaps sanitation, and even access to health care. And the other thing we've noticed with these persons that suffer from neglected infectious disease is that oftentimes these diseases are kind of absent from the global health agenda and even have maybe little funding, and is very much attached with stigma and
Obviously,
discrimination.
over a few decades, HIV and AIDS came, and that became a priority. And I think
Yes.
that's the only existing human infection. And then subsequently, for the past 2 years, we've now dealing with COVID-19. Hence, we're wearing a mask on the television program. And
Yes.
so, yes, you can see that a lot of these tropical diseases took a back burner.
Yes, that's so true. And COVID-19 affected us as it affected probably most, if not all, of the programs. But fortunately, the Ministry of Health, especially our program, we've really been pushing to put the COVID-19 and the disease management within the right context, at least patient care. The standard is maintained.
Quickly, as you talk about filaria, give us an idea what's happening there, and your department got to meet its target.
Yes, well, interestingly, we have completed, as perhaps the most of the audience looking would know, we've completed our second consecutive year or round of the Mass Drug Administration activity using ivermectin, decanalbendazole in 8 of our endemic regions, which are all. Only 8 regions are endemic in Guyana. We've successfully reached the target that it was recommended by WHO, and we actually started last year in the last quarter our first post surveillance survey, and we're culminating that right now.
And just in case anyone didn't get to and they fell off the radar in your last campaign, how is it too late for them to come to get the medications, and how can they get?
It would be too late in terms of the mass drug administration,
Right.
but if they go to their nearest health center, because we're trying to decentralize, and we find that they're a positive case or anything, we do treat you on an individual basis, but not on the house to house and walking. That mass drug has passed successfully, but we do deal with individual cases that pop up still.
And so they can visit their nearest health center.
Yes.
And if that's not available, they can be referred to where that is.
Vector Control Services, we're in the GPHC compound above outpatient, and they can call Vector Control Services at, I think the number is 225-8973, and just ask for the filaria clinic if they want to refer to it like that.
All right. So, there's comes to the end of the first segment of our program. And when we come back, we'll be talking about some more of these diseases that is prevalent in Guyana. And as we observe Neglected Tropical Diseases Day 2022. Stay with us.
I'm a lover of dancing from since a small I danced the foxtrot. I was sitting home watching TV, and while I was watching TV, I felt a pain in the foot. So I went to the hospital, and then they find out that I was having the filaria.
Lymphatic filariasis can be a chronic disease, and left long enough without being treated or identified can cause debilitation. If you're infected as a child, it's there, it multiplies in your system, in your body for years until it actually causes damage to the lymphatic system, and then you have the sequelae, the elephantitis, the hydrocele, and so on.
I was a qualified referee of Guyana, and I had to do a lot of heavy training. So it left in me that I learned to dance, and I got to be a dancer, so that's one of my exercise. And one of my exercise, that's why I'm so good at the age of 72, is I do a lot of walking. I do not get transportation, I do a lot of walking. I was worried about then because my friends always invite me to a party to go and dance. Because I got some friends who love to see me dance. So when it started to swell, I couldn't wear sandal, I couldn't wear a shoe. I couldn't even go to church.
So once they come here, they get that care that is required. If they have an ulcer, if they have whatever entry lesion that they have, that is treated here.
When they used to share these tablets, I used to disregard them. And when I know the importance of the tablet, when I got this foot, then when they come around again and give me tablets, I throw down my throat in front of them and say, when I go inside and drink some water. So it's very good.
These patients are listening to us when it comes to taking care of themselves, taking care of the affected extremity. They're listening to us when it comes to following the treatment regimen for lymphatic filariasis. Most of the patients with lymphatic filaria, the stigma that's attached to them, it's something that's overwhelming.
Yeah, these times your name changed. You're no longer who you are, a Bigfoot lady. A Bigfoot woman. You have some neighbors. As soon as you put your face to the door, you're Bigfoot so and so. That is how you face the life every day.
Recognizing that so many persons have been afflicted, recognizing the loss of years of production and their ability to contribute to society, and then their personal losses, I think when you put that all together, we recognize that it's worth investing in upfront and prevention, and therefore the ministry has decided it's worth the investment, and we have fully embraced the strategy for elimination.
The program has two main components. One is what we call the Mass Drug Administration, or MDA, And the other component, the second component, is the management of the chronic morbidity caused by lymphatic filariasis, especially lymphedema, and hydrocele lymphedema is also what people popularly call elephantiasis, or here in Guyana, Bigfoot.
The decades of lymphatic filariasis, the cost to society, the cost of drugs, the cost of the stigma, the human suffering is going to be cut down. And that, for me, it's priceless.
That would be good. I have 6 children, I have 12 grandchildren, I have great-grands. And that would be very, very good. Because as I say, I wouldn't like to see a dog go through this.
Since I started Radio Street back, I still dance. My friends and still give me a call.
Welcome back to our program. Just to remind you, as you would have been reminded in our ad break, please try your best to observe all the protocols and guidelines of COVID-19. I've got now Dr. Anastasia Samson, and she'll be talking to us, about some of these diseases that they treat in Guyana. And Dr. Niles would have talked about filaria, and so we get some more details. Filaria, doctor, how is that caused, and what are we to look out for when we suspect that we may have that?
Okay, thank you for having me, Mr. Hussain. Thank you for having us. So lymphatic filariasis, as persons would commonly know it as filaria, is one of the neglected infectious disease, and it is caused by the bite of an infected Culex mosquito. Mm-hmm. So what happens is that over time, this bite, or the bite from that infected Culex mosquito, causes damages to the lymphatic system, that in turn cause clinical manifestations such as swelling to the arms, the leg, the breast, and in the case of the men, the scrotum. So these are the clinical signs, or the most important clinical manifestations to look out for when you're suspecting a patient or someone has lymphatic filariasis.
Right. And the treatment, we spoke about that campaign you had. But I can remember there was a previous campaign many years ago, and something which became very, trending was Dexalt. Is that still applicable in how we, consume Dexalt? Does it help?
So we would have stopped the use of Dexalt many years ago, due to the fact that with new studies and new recommendations from the World Health Organization, we would have scaled up to using more effective medication. Mm-hmm. For example, in our just concluded mass drug administration campaign, we had the triple drug therapy, which included the use of albendazole, which is a common dewormer that we're all familiar with. We would have been using that from since we were 2 years old. We would be dewormed on a regular basis. We also have the DEC in the tablet form, that is. Uh-huh. The DEC in the tablet form. So we moved away from using the Dexalt, and we're using the DEC in the tablet form that was also given to persons. And this specifically targets the worm that causes filaria. And we also use the ivermectin in our treatment when we had our mass drug administration campaign.
What's another disease that you see from time to time and causes you concern?
So another one of the neglected infectious disease that we see and that causes concern not only for us but persons that are affected by it is leishmaniasis. Person know it as Busheyer's or life sore. So yeah, that's another disease, and this one is caused by in this case the bite of the female sandfly. Mm-hmm. So we see that these tiny vectors are what causes these grave diseases. So that is caused by the bite of the female sandfly, as I mentioned before, and over time this causes an ulcer on the exposed part or wherever that sandfly would have bitten, it causes an ulcer on that exact spot that that sandfly would have bitten that person.
And is it a specific sandfly, or is generally sandfly that you would normally know people who living around river areas, or these sandflies can be bothersome? Is this the specific? And where in Guyana is you find most of these incidents of bush yards, as we want to say?
So as I mentioned before, it's the female phlebotomine sandfly that actually causes this disease. In our clinic, we would see patients coming from regions 1, regions 2, regions 7, regions 8, region 9, and region 10. So those are some of the, the non-official endemic regions based on where we see these patients coming from. That's where we would say, okay, these are the endemic regions.
And is there any prevention, before you reach that stage that the public can take note?
So prevention, with respect to lymphatic filariasis, or
no, with the bush yards.
Okay, with respect to bush yards, yes, we advise persons, because what we also find, we have persons in Region 4 also that would go to these interior locations for jobs, mining and logging and so on, that they would also be affected. So we encourage persons, if you're going to these regions, the vector control services, they can have the mosquito or the treated nets that can help them, that they can use to prevent insect bites and so on when they're sleeping in their hammocks. We have those for the hammocks and the bed. They can use those to actually prevent them from being bitten. And also we advise that they wear long sleeve clothing to avoid bites also. And they can use their repellents. Be careful not to have stagnant water in your surroundings, and of course, a clean environment is always helpful in preventing you from acquiring vector-borne diseases.
And coming back to filaria, what could be some of the recommendations for prevention there?
So the first line of prevention for against lymphatic filariasis, was taking part in the mass drug administration campaign, where we were giving, as Dr. Niles would have mentioned, preventative prophylaxis to the entire population. Whether you have clinical manifestations or not, you were given that opportunity to take your pills. That is one way of preventing you from getting lymphatic filariasis. Of course, I mentioned again, the mosquito-treated nets can also be used. And of course, tidying up your surrounding, no stagnant water, whether it be in old tubs, drains. Keep your surrounding clean, because these vectors, they love these surroundings to dwell in. So if you eliminate all of the garbage pile up, cleaning your drains, eliminating stagnant water, you find that you will have an ease, so to speak, from these vectors in your surroundings.
Sanitation is the key.
It definitely is.
What are the diseases you would come across? I know leprosy, not necessarily a buzzword now, but around the world we still have that. We did not wipe it off the face of the earth.
Yes, we still do have that, and that is being catered to by our sister program, the leprosy program, and that is persons can find or have access to that services at the PALMs.
Right. One of the things we find Guyanese would jump to when they see they've got certain infections, they go after bush medicine. Maybe Dr. Niles, you could speak to that, the dangers of that.
Well, as a Guyanese myself, we do love our traditional medicine. It's a part even of our culture. And we don't say that it's not helpful, but the thing about traditional medicine is the quantity, so therefore we don't understand how therapeutically helpful it can be. We can't measure that. Whereas these neglected infectious diseases, they require some very specific and detailed treatment protocols and management, because these diseases can be asymptomatic, and when we do find them, they require aggressive treatment. Now, the thing about what we advise our patients to do, we prefer I know a lot of them spray the wounds in some cases, for example, the bush yards. They sprayed with this animal purple spray,
Oh boy.
and they damage the skin. What we're asking you to do is you need to cure that wound, because when you come to our service, we still have to take time to make sure that wound is cared for, the skin is healed before we start treatment, because sometimes the very things that we do can actually cause infection, superimpose infection, fungi, viruses, and bacteria. So what we would advise the patient to talk with us and let us discuss what is the beneficial traditional medicine that can help. Because, for example, guava leaves, we know they're antifungal. We won't recommend those to you just like that, but we are willing to have a conversation to at least fill that gap. But I just wanted to say that the treatment for neglected infectious diseases is actually very complicated, because the epidemiology and the whole of neglected infectious diseases is very complex, because first of all, they have complex life cycles, they have animal reservoirs, these persons face discrimination and stigma, and all of that makes this public health control of these diseases very challenging. So, and when we're trying to teach persons, and which is with the very World Health Day helps us to do, or I should say the World NTD Day 2022 is really to bring awareness to persons that this is a service that is available to you right here in Guyana, and we're going to expand. But the other thing we want persons to do is that once you are affected, treatment, it really needs to deal with how you are currently, because if you're sick, we can't give you the medications, because these medications, the side effects are sometimes, some people say, even worse than the disease itself, but it is necessary until, of course, the scientist works to create better drugs with less side effects. And even the therapy course could be months. Sometimes for Chagas, even 2 to 6 months. For leishmaniasis or Bushras, it's 20 days. And that's 20 days without working, because the person can't take the drug and go to work because of the side effects. They need to rest, they need to be hydrated, they really need to be in a positive environment. And then the wound sometimes is so big because they have taken too long and they use the bush medicine and cause a little bit of infection. And sometimes very bad infection we have to deal with, and that even delays treatment further. So we would ask, the family members and those that are at risk and those that are suffering, everyone to be a little bit more understanding that the body does need to heal. We can't rush it, but once it's done correctly, you are healed. Once we catch it early.
And of course, these are further complicated if you have things like diabetes and so forth. As you were talking about that with the bush, two things came to mind. As a youngster, you always hear the word poultice and then mercurochrome.
Yes.
When you were talking about that purple medicine. We're in the COVID-19 pandemic. People who have now will realize that they are suffering or affected by some of these tropical diseases and would have gotten COVID. They should not be worried. They should go and take their vaccines. Should they have any worry about vaccination?
Well, I've taken my vaccine, and I'm not worried. So I would encourage each person, if they can, they should take it. Of course, consult your doctors if there's any underlying issue there. But I've taken mine and I'm quite happy with it.
Right. So as we wrap up our program, your department is really doing a great job, and you really want to get filaria out of the way. What is happening so we can reach filaria to be less of a concern, worries for us here in Guyana?
Well, we have in the neglected infectious disease department, it is challenging because these diseases are complex, but we do have some achievements. One being that, for example, we have completed 2 successful years of this mass drug administration, and we're moving along that framework of elimination, and hopefully by 2026, after doing, of course, the requisite monitoring and evaluations that are necessary to make sure that the transmission is no longer possible, we can say, hope, God willing, in 2026, that Guyana has eliminated lymphatic filariasis. So we're very hopeful of that. And so far, the Ministry of Health, along with the partners, we have been working towards that. Another achievement I would want to bring is that we have been able to, the neglected infectious disease department, even based on the filaria, we've been able to do some intercollaboration, some cross-cutting interventions. We've been able to, for example, with the MCH, we had to collaborate with them a bit to speak about when we were doing our mass drug administration and the giving of vaccines. We do have to speak with them often, even education, because we were distributing these drugs in the schools, even local government, because the local authorities needed to be aware, and they were taught as well, and they came out. So that's one of the achievements, and hopefully it will be helpful for the other diseases as we go forward in helping to control and eliminate those infectious diseases.
Any more achievements at your end, Dr. Samson?
So, adding to what Dr. Nazim have mentioned, we also want to inform our viewers that we're on our way to do a strategic framework, a strategic plan, for the neglected tropical diseases, whereby we can standardize our management protocol, treatment protocols, so that when we decentralize our services, all regions we will be on the same page, so to speak, with respect to management and diagnosing and treatment of our patients. And finally, we would want to thank our technical partners, the World Health Organization, Pan American Health Organization Country Office, who is always there, willing and helping, willingly giving their support to the neglected infectious disease department, and of course, the vector control services.
Dr. Niles, as we wrap our program up, and here's an opportunity, if there's a particular message you'd want to leave with the Guyanese about the work and their mandate as Guyanese to have a safe environment, a clean environment, what would that message be?
Well, what I would like to leave, and thank you for the opportunity for leaving this message, is to let all the audience know, all the viewers know, that maybe the theme of this year for the World Health 2022 said it best: achieving health equity to end the neglect. Wherever we've been neglectful, maybe in our sanitation, whatever we are capable of doing, let us do our best. And also we will challenge ourselves within the Ministry of Health also to bring what services we can to the public. But we know it's not a one hand. If two hands have to shake, we have to hold hands to walk together. So I know once everyone puts their foot forward, we can do it. And they don't have to worry. Once you are aware of a problem, come to us. We will not deny you. No one really wants it. Guyanese, we're very friendly. We know no one wants to see another person sick once we can help. And you come and we would work with you. And we learn from the patients a lot, and they learn from us too. But I want to say sometimes we learn more from them, because they're the ones that are suffering. And we need to have an open ear. That stigma, discrimination is not something you put aside, you address it. Yeah. And we hope too with this coming years, and especially this year, we could even collaborate with the mental health department, because there is a mental health component. If a patient doesn't feel willing, sometimes they don't want to do it. They don't see why all this effort is needed if it's just hopeless. But we just want to let them know there is hope. We are willing to work together.
Doctors, thanks a lot for being on our program.
Thank you for having us.
And we do, all of us at the Ministry of Health, do encourage you at all times to take care of your health. That's all the time we've got on our program. Do join us again next time. And until that time, stay well, stay safe.